of science translation, because COVID-19 highlighted the importance of ensuring people understand the science, and it's provided to them in a way that's meaningful and understandable, and as well as accessible to their lives. COVID-19 highlighted the importance of ensuring people understand the science, and it's provided to them in a way that's meaningful and understandable, and as well as accessible to their lives. 19 highlighted the... Sorry, I think there's some echo somewhere.
I think Judith should briefly mute, perhaps.
Oh. Great, thank you. Can you hear me clearly now? There's no echo, right? Excellent. Thank you. So I was saying that COVID-19 also highlighted how communication has changed amongst people, and so we needed more innovative communication to make sure that the science and the evidence reached people in a way that that was understandable. So in WHO, we had a call for to ask people to share how they have been communicating to communities, and we compiled a list of innovative concepts in science communication. And we had 78 submissions from all over the world, and we looked at them, we judged them through 4 criteria. One was the accuracy of the science, second is from innovation, the third is from gender, human rights, and equity perspectives, and the fourth is from evaluating the impact of the work that was ongoing. And I'm very happy to share that today, the 20 case studies that were most highly rated are on our website. My colleague Tim has already shared the link on the chat. So please do go ahead and have a look at the different case studies. Part of those, each of those case studies have been presented or will be presented in this webinar. And both the innovations you see today are part of those case studies. Today, we're focusing on chatbots and how they've made an impact. And we have one example from a low and medium income countries setting, and another in Africa. The other is from Europe. 2 different contexts, but both exciting. We have today, so let me, without further ado, introduce Amy Ansari and Usman Monkuno, both from Clear Global. Amy is Chief Executive of Clear Global, and Usman is from Clear Global Nigeria. They're also formerly known as Translators Without Borders. So welcome, Amy and Usman. Please let us know your work and how that's made a difference in Africa.
Thanks very much. I would hesitate to say that our work has made a difference in Africa. It may have made, I hope that it has made a small difference in Northeast Nigeria. I am the Chief Executive of Clear Global, formerly Translators Without Borders. I'm right now in this role as the interim country director, and I'm joined by my colleague, Usman. So a little bit quickly about, so we decided to develop a chatbot for a couple of different reasons. We needed a content partner to support us because what we do is really language and language technology. So we needed a content partner, and happily Mercy Kaur thought it was an interesting idea and decided to try it out. The chatbot we developed is called Shehu. Shehu is a person who is trusted by everyone in Northeast Nigeria. Some people look up to the Shehu, and he's somebody, generally a he, not always though, as Usman told me, and Mongono, the Shehu is a woman. The Shehu gives information and listens to people. He's not somebody who forces information on people. So that's a little bit about what a Shehu is. Sorry, I'm trying to do two things at once here. As most of you will probably know, a chatbot is at its core a computer program that can recognize text or voice-based inputs and produce outputs that interact with a user. Very early chatbots were menu-based and only able to follow a limited script. The user had to know which menu option to select to get the answer and to get the answer they needed. But the kind of chatbot we've produced uses conversational AI. So why did we decide to do a chatbot? With a disease like COVID-19, which is what this was developed for, it can be, it's spread, obviously, we all know this now, it's spread by people being too close to each other, and between a person who is infected and the person who is not infected, protective measures can help. So what we really needed to do was work with the humanitarian community to find alternative methods of communicating information about COVID-19. We needed to find a way to get people the information they want and need, and ways they wanted and need it, and critically in a language that they understand. Who is Shehu for? So most of the people that we built Shehu for were from Borno State, Northeast Nigeria. Because it is a chatbot, most of the people we were targeting were young. Interestingly, a lot of the engagement from women came in Kanuri. So the chatbot right now, so Shehu works in Hausa, Kanuri, and English. But most of the Kanuri speakers were women, which surprised us a bit, but we're going to talk a bit about that a little bit later. And most users used Hausa and Kanuri once they understood that the chatbot spoke to them in Hausa and Kanuri. They mostly expected it to speak to them in English at first. I'm now going to pass to Usman, my colleague.
Hi, my name is Usman Monguno, and in this capacity, I am the community engagement officer. So
oh, that's too bad. Oh dear. Usman? Okay, I'm going to take over for Usman here, since he seems to have dropped out, sadly. So Shehu is programmed to provide information about various topics related to the ongoing COVID-19 pandemic. It's also regularly updated based on new data and information to ensure that it shares accurate and most up-to-date information. For example, a commonly asked question was, how many people have COVID-19? Shehu answers this question by pulling data, up-to-date data from the Nigerian Center for Disease Control to help people understand what the current situation is. Clear Global staff also track down answers to common non-health questions like, where can I get a COVID-19 loan? Which was a common question in Nigeria. Our global technology team works on the cutting edge language technology behind Shehu. As I said, using conversational, artificial intelligence, natural language understanding, and our community engagement team in Nigeria, in Maiduguri, researches and chooses the content. The picture here shows an example message in English, in the English version of Shehu, when a user has asked where they can get vaccinated. It's kind of fuzzy though, that. Usman, anytime you are back, let us know. So Shehu COVID-19 was an interesting test case for a chatbot, because this chatbot combats misinformation and disinformation, particularly around vaccines, because it doesn't propagate myths and rumors. it allows a user to ask a question as opposed to saying, you can't get COVID from, or you can't cure COVID from rice water or whatever. It also allows us to hear and understand, because people can ask questions in any way they want. It allows us to hear and understand what rumors are happening, what rumors are going around, what concerns people have. Due to religious beliefs in Borno State of Nigeria, there's a high number of people that don't believe in COVID-19, and consequently they believe that the vaccine is targeted to harm them. Shehu it responds immediately. It's not a hotline like you have to call and wait for somebody to pick up or leave a message. So people don't have to wait to get questions to the issues that are important to them. They can ask questions whenever they want, when it's convenient to them. And it also filled an information gap when some traditional communication methods risk spreading the disease. It's also nice because it's very human-like. I was going to show a video here, but I'm not sure of how it works. I'm not sure this is going to work. Let me see. Is that working?
We can see the video, just no audio, Amy. I don't know if there is any.
Okay, well, there's no audio with it. So, but this is just sort of how it works. So you ask it a question, you get a response pretty quickly. It asks you if there's anything else. So, you can tell it sounds almost like you're having a conversation with an actual human being. And it's not, obviously. So you can see it's pulling from the Nigerian Ministry of Health website. Okay, sorry. Okay, so how did we involve one of the big important parts of Shehu was that we didn't do this in isolation. It wasn't just a chatbot that we rolled out. We did it as part of a program, as part of Mercy Corps' program. So we involved the community a lot in developing it. We conducted focus groups with people from the community, with women, men, youth, people with disabilities, and elderly people. We carried out those groups. It was about 52 people that we talked to. Mercy Corps also engaged another 100 people in testing out the bot so that we can iron out any usability issues and see how people felt when they were using the bot. The community engagement really helped us to understand what people needed from the bot and how they felt about using the bot. Potential users of the chatbot wanted a service that answered specific questions they had about COVID-19, let them use their preferred language, and let them access information on their own time. The key barriers, we understood a lot more about what some of the barriers were from the community engagement we did. They found that potential users, as I mentioned a little bit before, they expected that anything on a phone or anything using technology only spoke in English. So we had to at the beginning of the chats, we would say that I speak Hausa and Kanuri too, just so people realized that they could ask questions in the language they were most comfortable in. We also found, of course, as many of us already assumed, is that there is a tech divide between men and women using and accessing the different technologies. This meant we had to find a way to bridge the gender divide and ensure as many people as possible could access the information they wanted. In the next section, we're going to talk about how our approach combined traditional and tech-based communication to address these challenges. Okay. So what we decided we had to do was really build a relationship with potential users, build trust in Shehu and the information that it shares, and raise awareness of the bot so that people would understand where the information was coming from, who the bot was made for, where and who was behind the bot. And we had to do it in a multilingual format. And that was critical in order to reach even more people with it. We did yeah, sorry, this is a slide about the partnership with Al Ansar Radio. So that was part of building that relationship. The guest speakers on the radio show included the Nigerian Center for Disease Control, the University of Maiduguri Teaching Hospital. There were call-in quizzes with prizes that helped listeners to try out Shehu in real time. So, for example, we asked listeners to find out using Shehu about the symptoms of COVID-19, and then they had to call in and answer. And then, you know, the first caller who got it right got a prize. It also allowed us to take suggestions and input from listeners, and you know, obviously became a part of a wider information ecosystem. Many users said that they took a screenshot of the information from Shehu and shared it with their friends and relatives in WhatsApp groups or via Facebook or Messenger. People learned to trust Shehu. That was one of the things that they said, was that they knew where it was coming from, they knew where the information was coming from. And because of this secondary sharing, although it was hard to measure, we knew that the extent of its impact was much, much greater than just the users. Another impact that we had, because it was a radio program, was that people realized they couldn't trust unverified information. So the Shehu, as you saw during the example, it told you where we were getting the information. And it helped to raise awareness of how to spot misinformation. People also thought it was quite fun to use, which is always a plus when you're talking about this. So the combination of traditional outreach with new technology helped us to reach many, many more people than we would have done alone with either of the traditional or the non-traditional pieces. And people got critical information. It also, interestingly, helped us to close the gender gap. As I mentioned very early on, we really wanted to reach women with the information we developed through Shehu. And Mercy Corps and Al Ansar Radio and Clear Global, we have gender strategies, so it's a big part and core to what we want to do. So we found out that we were able to really reach women as users of the bot. As we mentioned earlier on, most of the Kanuri users, like 94% of the people who use the bot in Kanuri were women, which we did find pretty surprising. Because our research demonstrated that language was a key factor that limits women's access to information. So we were quite pleased that by providing a bot in Kanuri, that we were able to reach more women. So what did we learn from this? So a few quick stats here. First, we blew our targets away. We didn't think we were going to reach 5,000 people. It's well known among smartphone users in Maiduguri. The vast majority of the users tell us they trust the information. The topics for the radio show are decided locally, partly based on what users are asking to the bot and addressing people's questions, particularly the questions that were out of scope for the bot. And we can update the information and the questions and answers in the bot pretty quickly because we have the radio call-in shows, we have the team on the ground, the community engagement team on the ground. So how can it help? It got people information very quickly when face-to-face communication was limited. It helped to keep information flows open, so it was a really nice way of two-way communications, promoting two-way communications. It reduced the load on some of the call centers by handling the most frequently asked questions. And that meant that call centers can handle cases where a person is really needed, not just for routine questions and concerns. It's also trusted information, and it can responsibly share real-time user data via the dashboard. It's not personal information, that's just what people are asking, what they're concerned about. It also, one of the things we found was that it also helped people to ask questions in a confidential manner because they were asking a robot instead of a person. And as we talked about, it helped us to listen to the concerns. The bot can hear people in a way. So there's still some challenges we have, and we are working on these. Users need to be able to read and write, and not everybody does. because Shehu is only available in text right now. We are working on a voice-based system as we speak, actually, and we probably need to include more languages. If we included more languages, then we could attract potentially more women to the platform as well. Chatbots are not, as I said, are not designed to stand alone. They have to be a part of an information ecosystem so people can get information from a variety of sources and triangulate that. That said, a technology like this scales quite easily and can talk to thousands and thousands of people in two-way conversations. I mentioned we had done some key informant interviews and some focus group discussions early on. Those reached at most 200 people. As you saw on the last slide, Shehu reached well over 5,000 people. And so we really are having a lot more conversations with people. As I said, there are ways of solving these challenges. We're going to introduce more audio content into the bot. We're restarting Shehu with Mercy Corps in a couple of weeks, so that we're going to do more audio so that people who don't read well or who are blind can still benefit. We're developing voice-based tools. We're developing it. We're not going to develop it more in more languages in this iteration, but there's another way we're going to go about this. It's a project that's a tablet-based system, so there's a lot more memory, and it's based on a Raspberry Pi, which I'm happy to answer more questions about if you have any. And then to really speed things up, we can start thinking about how we use more advanced language technology like machine translation. And I think that's about it from us. We'd love to hear your thoughts and feedback, and thank you so much for listening, and thank you very much to WHO and our colleagues there for highlighting this this innovation of ours. Thank you so much.
Thank
I'm
you
sorry
very
Usman
much.
didn't get to talk.
Yeah, sorry about that. My network got cranky.
Would you
for
like to
listening.
add anything now, Usman?
Looking at the time frame, I think we are good to go, and we are going to handle the questions later. Thank you.
Thank you very much. Thank you, Amy, for that. And thank you, Usman, also, although I'm sorry you couldn't speak due to connectivity issues. But there's lots of interest. That was a fascinating presentation, very, very interesting. And there's lots of questions, but perhaps we'll take the questions at the end of the session, if that's okay. And you might also wish to answer some of them, but which are being shared on in the Q&A place. But you know, very interesting work, and really glad to hear from this. I'll go over now to the next chatbot work, which is unique. One of the examples of really good UNICEF and WHO collaboration. We have Nabiha from UNICEF Europe and Simon van Borden, as well as Kim from WHO Europe, to talk to you about Health Buddy. They'll explain to you right from how it started, right to operationalization and implementation of the entire chatbots. So over to you. Will it be Simon first or Nabiha?
Thanks, Apriya. Yeah, I'll take us away just quickly. So first of all, thanks and a big congrats to the colleagues in WHO in Geneva for the initiative, the case studies, as well as this webinar series. I'm very glad and eager to be a part of it. Really a pleasure to be here to present some of our projects. As mentioned, it's a joint project between UNICEF ICARO, so the Regional Office for Europe and Central Asia, and WHO Regional Office for Europe. Although I should say, per our rebranding, we're now WHO European Region, if I'm not mistaken. And it was also a huge pleasure to hear from Amy and Usman on the Clear Global project. I think there you'll see some parallels, but also some interesting contrast, I hope. So without spending too much time on the intros, just let me run you through some of the points that we'll touch on. If we go to the next slide. Welcome introductions we've done. So I'll give you a quick overview of the project so far, called Health Buddy Plus, and then hand over to Kim to talk us through in more detail how things evolved over the 2 or so years that we've been running this. We'll go in a bit deeper into the two-way listening and analytics, and I believe that Nabiha will come in here with her expertise. And finally, pull out a couple of examples of how we rolled this out across our region. For those who are not familiar, the WHO European region is not just the European Union, but extends all the way through to Russian Federation and the Central Asian republics. So yeah, huge diversity, and some of that we'll touch on in the details, how that made a difference for our project from the regional level. If we go to the next slide, just as an overview, similar to what the introductions have laid out, and I think it's similar to what Clear Global and Amy and Usman said, the aim for this project is really to support that risk communication, community engagement, strategic objective of getting two-way communication on COVID-19 between, in this case, WHO and UNICEF and at-risk communities. So it's a joint project, as mentioned. It's multi-platform. So we started off with a web app and expanded to mobile app, and most recently added further third-party integrations across social media platforms. Some areas of focus include innovation and digital health, as you might imagine. A strong component is a focus on two-way communication and infodemic management. We'll show that in a bit more detail, but we have some functionality, especially in the mobile app, to support the tracking of and responding to pieces of mis and disinformation. And finally, it was a multilingual project from the outset, with 16 languages and 14 focal points across our region. Mostly those have been colleagues in WHO and UNICEF country offices. And so we owe a huge debt of gratitude to all of the people involved in this project. I should also mention that we actually started off with a broader range of languages, but have seen in the user data that some of those were getting less pickup. We have some hypotheses about why that was the case. But just a note, and I know that Kim and I had some exchanges about whether or not we should mention that. But we started off with 20 and retired a couple and added a couple new ones. So that's Health Buddy Plus in a nutshell. I think I'll pass to Kim for some more details about how this project has evolved.
Thanks a lot, Simon. Hi, everyone. I'm Kim Rambeau, working on the Health Buddy Plus project from WHO Europe. So just looking really quickly at the timeline, it's been a really action-packed few years for all of us. And within the Health Buddy project, we began our efforts really at the start of the pandemic, gathering all the information that we could when little was known and the science was evolving very rapidly, and which culminated in a launch in May of 2020 on web of 8 languages. So we started with these 8 languages, and again, based on our offices, joint WHO and UNICEF across our region. Then moving forward, we saw that there was big success with these 8 languages and a lot of demand for more languages, as well as some additional functionality. So in October of 2020, we launched a mobile app and expanded to, this is when we hit 20 languages, as Simon mentioned. We recently reduced it. So initially it was at 20 and now we're down to 16. And really we want to serve the languages which are the most useful and getting the most use. So that's really one of our priorities, but we can maybe answer some Q&A on that. So once the mobile app was launched, and Nabiha will share in a bit about what the mobile app entails, last year in May of 2021, we expanded to the social media messaging platforms, as we see that this is really where users are. Websites and mobile apps are great, but people are really, the communication is really integrated into these platforms, and this is where people go. So as Health Buddy does, we always try to innovate and remain agile to go where the users are. And during this time, we, together with our focal points in the countries, began launching the chatbot on all kinds of different websites, from Ministry of Health to media, to university websites. So really embedding the chatbot so that it's available to people in a number of sources and locations. And then most recently, with the ongoing war in Ukraine, we adapted and added Ukrainian to the Health Buddy Plus COVID-19 content. And then now we're looking to again, pivot a bit more and respond to this ongoing emergency through the content, which I'll get into a little bit more later. So this is Health Buddy from nearly 2 years, and it's been very fast. It's been a lot of lessons, and over to Nabiha to walk us through some of the key functionalities.
Thanks a lot, Kim, and a big hello to everyone. So my name is Nabiha, and I work as a technology for development consultant with the UNICEF ICARO. And now I'll talk a bit more about the technology and the functions behind Health Buddy. So, Health Buddy was created basically to counter the spread of misinformation regarding COVID-19 in the region. And the idea was to, again, create a conversational chatbot. So not just provide like predefined set of questions, but rather help users interact in their local languages with the bot and get reliable information. So this is an AI-powered chatbot based on NLP technology. And as Kim mentioned, Health Buddy is available on multiple platforms. So initially we started off with the website, so healthbuddy.plus is our website. And we also have this capability of embedding the chatbot on multiple local websites. And a lot of country offices actually did that. They embedded the website, the chatbot on national websites in their local languages. Basically then we launched a mobile application, which was available on both iOS and Android platforms. And then a turning point for Health Buddy was actually when we made it available on social media messaging platforms. And those platforms include Facebook Messenger, Viber, WhatsApp, Telegram, and VK. So this gave users a wider access to this reliable information. And also a bit more about the technology that is based. So I'm just not going to go into the depths of it, but basically Health Buddy is built on the Rapid Pro platform, and it is connected to BotHub for the intelligence. So basically on the website and on the mobile, on the website and the embedded chatbots, users can have a conversation with Health Buddy and get answers to their questions related to COVID-19. But with the mobile app and with the social media messaging platforms, we were able to expand further and provide additional functionalities, such as reporting rumors. So our users are able to report rumors in their countries, in their regions, rumors that they've been hearing. And that has been very interesting for us to gain insights further into each country. And they can also answer polls. So this has also helped us understand our user base even more. So via the social media messaging platforms and via mobile apps, we gave users access to certain surveys and polls which they answer. So basically in the span of the pandemic, we managed to launch about 3 polls. Each poll was run for around 7 to 8 months, and each poll had a theme. So like from the first poll was more related to understanding the COVID-19 situation from the user's perspective. The second one was regarding vaccine readiness and whether users would be eager to get the COVID-19 vaccine. And then the third was for us to get to know our users better and how they use Health Buddy and how it supports them. So now I'll hand it back over to Kim to walk us through more aspects of Health Buddy.
Thank you, Nabiha. Right. So as we are all doing a tremendous amount of learning over the past couple of years and within this project, one thing that we were really able to innovate on was accessing the user questions, which are all anonymous. There's no user information beyond their question here. And looking at these questions from the 20 different languages and now 16, seeing the different themes that were arising. So one thing that we were able to do was, and this slide is kind of messy, but it's a little bit of a flow chart of the process of how we go to understand the user question. So from the backend system, we upload it, we extract it, use Google Translate to translate, or sometimes rely on the country focal points. But again, sometimes we were getting upwards of 2,000 questions in a 2-week period. So this is a huge amount of translations to ask our colleagues who are already extremely swamped. So using Google Translate, which we found gave us more or less good translations to get the general theme of it, and using a thematizing system to understand and look at the different themes that were arising across languages. This really helped us understand what were the hot topics on the users' minds? Where, if any, are there information voids which we need to seek to address in developing new content? And also just tracking general risk perception surrounding COVID-19, vaccine acceptance and understanding. It really was a really nice way to understand what people are looking for, perhaps even more important for this project, as it is a communication device, is how people are asking questions. So really using the language that the users were using to tailor our content and how we were writing content, and also the technology to then map the types of questions, the way they ask, right? We know there's so many ways to say COVID-19. We can say COVID-19, we can say corona, we can say coronavirus, we can say coronavirus with a K. So really understanding all these variations and making sure that we're able to capture them at the back end to lead the users to the questions they're asking. So this was hugely informative. And you can go to the next slide, please. So this is just a snapshot of using the user questions, the polls, and the rumors to adjust the RCCE response at both the regional and country level. So here you see it was a snapshot of Albania. And so for this moment, there was a lot of questions falling under the themes of how to obtain testing services, what kinds of tests are needed to go here, to go there, which tests are better, which tests should I take if I have this situation, as well as, of course, a great amount of questions on vaccination. And then this was quite early on in the vaccine process, if I'm not, the vaccine rollout, if I'm not mistaken. And so there was a lot of questions around the proof of recovery documentation when many countries were rolling out vaccine certificates. So, and also people are really trying to understand what the situation is in their area. So what we did was link, whenever a user types the country, we link to the WHO country dashboard where they can look at all the latest statistics to understand what the situation is. And it's also really important to highlight here that so many of the questions were extremely contextual and very specific to not only countries, but cities and communities. And so working together with our colleagues in the country offices to understand what are the best local resources to direct users to. Is it the local testing website, mental health resources that are available, any type of resource that users were seeking? We really wanted to find what was the best local resource that we can link them to, because the content is a regional base and we can only cover so much specificity from a regional level. So we really work closely with our colleagues and the national partners to make sure that we're adapting and adjusting for the users' questions in their context. So next, we'll look a little bit into 3 different case studies from 3 countries, just very quickly, a snapshot of innovation. And I'll pass over to Simon to walk us through Bulgaria.
Thanks, Kim. And I think you hit the nail on the head with what you said about the power of local or national in our case, that from the regional level, things have to be a little bit generic just because of the multiple countries that we're covering. But I think we've seen the examples from the 14 or so country offices that are participating really add a new dimension of power and outreach at the national and local level. So I won't read this quote out loud, but you'll see here Ivo Spasov, a great colleague of ours from UNICEF Bulgaria. And you can see him in the photo, and Misho, our colleague from WHO, and some of the other team members that have been such an instrumental part of rolling this out in Bulgaria, and also innovating solutions, because that's another part of our project, is the ability to share peer learning from one country to the next. So in Bulgaria, for example, something that was innovated by the colleagues was a strong partnership with national media, including a live TV launch at prime time, demonstration there, also engaging with regular two-way communication. And one thing that they did that reminded me during Amy's presentation was take some of the questions that they were seeing in their chatbot data and pull them out and use them as scripts, basically, to do a Facebook Live. So combining, again, those different types of channels and using the user data as a source of listening to inform what are health concerns, what are the at-risk community's interests and needs in terms of health information, and then what are the different channels that we can give that information. And also strong focus in Bulgaria on mental health. So lots of referral to local and national mental health services. We all know that COVID put a huge strain on the health system for infections and hospitalizations, but mental health effects of the PHSN, the restrictions, people having to stay at home, just the sheer impact of losing someone or being afraid to lose someone or become sick. A big strain on the mental health services as well. And so colleagues in Bulgaria made this a key pillar of their implementation of Health Buddy Plus.
Thanks, Simon. And I would just like to add that, a big kudos to all of our country offices for promoting Health Buddy, for creating tailored promotional material for Health Buddy Plus, and also for innovating with us and being agile with us. So another interesting example would be of Uzbekistan, because the Uzbekistan country office was the first country office to actually promote Health Buddy on a social media messaging platform. So they informed us that Telegram is very popular in their country, and they would like users to be able to access Health Buddy on that. And this was indeed the turning point for Health Buddy Plus when we launched it on Telegram, because we could see a clear exponential rise in the number of users. And of course, our reach was wider. We were able to reach a wider audience. And to date, we have about 7,000 users using Health Buddy in Uzbekistan, in Uzbek language. And we have users in Russian language as well. So we were able to make, Health Buddy available in Uzbekistan, in Uzbek and Russian language. So this was an interesting example for us to share. And I would also like to share a quick 30-second video of the kind of promotional material that countries share. So this one is from Uzbekistan. It's a video in Russian. So let me just share that. I hope you can all hear it.
Не все, что мы читаем или слышим, правда. В цифровом пространстве большое количество ложной информации и советов касательно COVID-19. Убедитесь в том, что у вас есть необходимые инструменты и информация, чтобы защитить себя и окружающих. Health Buddy – это универсальная платформа, где вы можете задавать вопросы и получать достоверную информацию о COVID-19. Задайте свои вопросы о COVID-19.
Thanks, Nabiha. That was really, really great. Just highlighting one last country innovation example, I'd like to draw your attention to the work that our colleagues carried out in Kyrgyzstan. In late of last year, we held, together with our other colleagues at the WHO regional office, working on the COVID response, specifically working on a civil society organization project. We held a training of trainers with one of the civil societies they're working with in Kyrgyzstan. This organization specifically works with older persons on digital and health literacy, but also specifically, given the times, on how to protect themselves and remain resilient against COVID-19 and other health emergencies. So the aim of this training of trainers was to meet with the CSO staff and walk them through a bit of what Health Buddy is and how it can help meet their objectives as an organization in increasing digital and health literacy with their beneficiaries. So in this session, we demonstrated the uses of Health Buddy, the ways that they can type questions in Kyrgyz and also in Russian, because they speak both those languages and many others. And also how they can use the predefined questions to understand a bit more some of the more hot topics that many other people are asking. And then also interestingly, use the rumor reporting tool, which they found to be very helpful and useful. Yeah, so they were really pleased with Health Buddy, and they shared it with their beneficiaries. And we received positive feedback in that they had previously used chatbots to work with them to combat a little bit of loneliness during the pandemic, because we know that isolation and loneliness was a big problem. It still is a big problem, even in non-pandemic times. But that the beneficiaries found that engaging with the chatbot, anecdotal evidence to say that it made them feel a little less lonely. And also it's a nice, the rumor reporting angle to give a little bit of agency in reporting some of the rumors and having a role in the pandemic response. So this is one way that we try to engage a bit more with communities. Of course, there's so much more work to be done, and we're really excited to keep the project going. If you could go to the next slide. Thanks. And with this last slide, I won't ask the question, but I will. So how can Health Buddy Plus be useful to you? As we've already highlighted, there's a ton of information on COVID-19, but also the parallel topics such as gender-based violence, schooling, mental health. Content is available, and all of the content is available in all 16 languages. And you have an opportunity to engage in the pandemic response by reporting rumors and answering polls. The current poll is getting to know our users. So if you're interested, I would encourage you to check it out so we can perhaps get to know you a little bit better and learn how to better serve you through Health Buddy. So looking forward at what's next for Health Buddy, we found that it is an agile model fit for future health emergencies. And as such, we're currently adapting to support the response efforts with the war in Ukraine for fleeing refugees, but also in neighboring countries so that they can act. It serves as a referral pathway. So when individuals arrive in a country, they're able to access very concrete Q&As, resources. Where can I get information about schooling for my child, routine immunization, mental health, and primary care health services. So we're currently working on getting that finished. We're exploring opportunities to scale to other regions. And of course, as we are life learners, we're looking to conduct some research to better understand the role of chatbots and health information seeking behaviors, and specifically Health Buddy, and how Health Buddy has been viewed and understood by its users. So again, if you're interested, please visit. And with that, I will close, and thank you all so much for your attention and attendance today. And thank you to the colleagues, and thank you for the colleagues at HQ for organizing. It's been great. Thanks.
Thank you very much. That was also extremely interesting, two different contexts, lots of similarities, also some differences. And the questions are pouring in now. So please, I request you to please also answer the questions on the Q&A as much as possible. But to start with, one question that's popped up several times is on access. So to both of you, but probably more so to Clear Global because connectivity is less there. Are your chatbots accessible even in areas with low internet connectivity? How do you make that more accessible? What do you do?
Usman, I'll let you take that one, please, since I had to do all the talking before.
Sure. Chatbots are mostly accessible for areas where there is internet connectivity and also network coverage. So for places that don't have internet connectivity, no network coverage, we don't have access. But however, for places that do, yeah, we do.
But can it work?
We're developing some new tools, I briefly mentioned, oh, sorry, my camera's off, but I briefly mentioned that we're developing a platform called Tiles, which is a tablet-based system run on a Raspberry Pi that should not only contain all of the information that we would have in a chatbot, but quite a lot more, and also have voice capability. So it should be able to do, we're developing so that it has speech recognition and that it can be used offline specifically for low literacy, low connectivity people.
Thanks, Amy. And what about the Health Buddy?
Yes.
Yes.
I wonder if sorry, Usman, did you want to go first?
Oh, okay. As in regards to the Health Buddy, we partnered with Nigerian Center for Disease Control, whereby we invite those people to our radio shows, and then they give health information, and then we also receive calling from participants and listeners out there in Borno State, and then they also provide the information. Thank you.
In terms of our project, I think, Supriya, I don't know if Nabiha can also comment, because she's has much more expertise when it comes to the technology. We did consider, I think early on, what the prospects would be for offline. I don't have the details off the top of my head, but what I can say is that the example that Kim presented from Kyrgyzstan is a nice, I think, example of showing how you can combine, online, digital, and offline approaches. Where, and I think the Clear Global example also strongly showed this, that by thinking, by not boxing yourself into, okay, a chatbot is this, it lives on your phone, it's a digital tool, there's data, but by combining and seeing it as a human solution for humans, and thinking what connections do you need to make with community facilitators. In our example of Kyrgyzstan, a civil society organization that worked with older people. And I think our Kyrgyzstan example in that regard is extra powerful because it kind of shatters a bit the assumption that chatbots are something for young people. And as Kim also highlighted, the added unexpected benefit of chatbots serving to reduce loneliness, to help manage those challenges from the pandemic. It's such a powerful example, I think.
Thanks, Simon. No, it is powerful. Talking about, having it as a companion, so to say. There's some questions here.
Sorry,
about...
Supriya, before we go to the next question, I think Nabiha wanted to jump in on the...
Oh, sorry, my apologies, Nabiha, please go ahead.
No, it's fine. It's completely all right. But yeah, I just wanted to add to Simon's point. So keeping our region in consideration, and also understanding that not everybody has access to good quality internet or Wi-Fi at all times. With that, this was one of the reasons why we also came up with the mobile application, because it's a lightweight application which can be used with 3G and 4G services as well. So the idea is to make it more approachable and reachable to as many users as possible. So, and also that's why we try to branch out into multiple platforms, so that people, whatever suits them, they can start accessing through that. So yeah, so just my 2 cents on that.
Thanks very much. My next question is, there's been a number of questions on how you navigate the whole issue of data privacy with these chatbots. So to both groups, Amy and Usman, and then Simon and Kim and Nabiha.
We don't collect any personal data. So we don't, it's not a huge issue for us.
Right.
Yeah, that's all I got.
Right.
Yeah. And the same goes to us, actually. So even though we're connected to social media platforms like WhatsApp and Facebook, we ensure that no user information comes in. So basically, the only thing that comes into Rapid Pro is an anonymous user ID. So that's basically a code, nothing else. We just ask users whatever information we want to capture. We ask users those questions in the chatbot, like their age, gender, and region. So that's about it. So that's what we are collecting.
Okay. So thanks, Nabiha. There's another question that was on building trust. Have you had issues in sort of building trust around a chatbot, considering, people are wary with so much misinformation and so much, uncertainty revolving around? Over maybe first to Nabiha and Simon and Kim, and then to Usman and Amy.
I can say a couple of words here. I think what helps us is, UNICEF and WHO, especially in the pandemic, I think are recognized as trusted voices to some extent, and not always uniformly, and not, things do change over time. But the fact that we were able to highlight that and say, the content that you will find in the chatbot is developed by experts working in these two organizations. It's adapted and expanded based on your questions. And then the ability to see that content base expanding and responding to additional topics. I think that was a big part of increasing the trustworthy perception and appearance of the solution. We haven't done, I don't think we have a lot of specific explicit data asking the users. We did run a poll on this. I'm wondering if Kim has anything from that one when it comes to trust. The only other thing I wanted to say is, again, the fact that our country office colleagues and local partners were involved in this and were able to embed the solution also on their web platforms, I think follows sort of the maxim of you want to be where your users are, you want to be using the trusted channels that they are familiar with. And we saw that was quite effective in boosting user numbers, which I suppose you can see as a bit of a proxy for trust in this type of solution.
Thanks.
I'll just say very quickly, Simon. Yeah, indeed, what you were mentioning, the trust goes with the country offices, and they know which channels are trusted and where to go there. But I think also just looking at the user numbers, we have a pretty significant amount of users coming to Health Buddy Plus, though it's tapering down a bit as interests are elsewhere. At the moment, I would say that because we have so many users, I think that speaks for itself, that people really do want to come to Health Buddy Plus, to WHO, to UNICEF to ask these questions that maybe they're not able to ask elsewhere. Thanks.
And to add just one more thought, an example popped in my mind, again, an innovation from a country office in Hungary, this time WHO Hungary. For their launch campaign, they partnered up with healthcare workers. So they approached a number of influential healthcare workers, physicians that also had a bit of a media audience. And we're doing a lot of community engagements, public communication work already. And basically partnered up with them as influencers, community influencers, to launch the solution. So that was another thing that we saw. And this is another tenet very common to risk communication, to make sure that you connect and liaise with community influencers, with leaders. And it goes both ways, because to be able to do that engagement, you have to also be open to inputs and feedback from those key people.
Thanks,
Yeah.
Simon. Yeah, over to you, Usman.
Yeah, thank you. So we were able to build trust using a variety of ways. One of them was by collaborating with University of Maiduguri Teaching Hospital. We have workers, medical doctors invited in for our radio shows. So being local people from the community and from the hospital, they give first-hand information, and also they could testify to the information that was provided in the chatbot. Other than that, also most of our informations were from the Nigerian Center for Disease Control, from the site, and then from getting pieces of information from them. So we were also able to build trust with that. And also working with the Al-Ansar radio. The radio is one of the trusted radio stations within the region. So having callers calling in, giving us feedback and also incorporating such feedbacks in the chatbot also helped in building the trust as well. Thank you.
Thanks very much, Usman. So, getting local people. And there are 2 participants here. We actually run out of time, but it just shows the level of interest, the number of questions we have. We have 2 participants who've raised their hands. Shanti Bogati. Yes, please go ahead. Okay. Maybe not. Shanti, are you there? I think you need to unmute yourself. Okay. The other person who's put their hand up, will go on, is Lucky Emmanuel. Lucky, please go ahead and ask your question.
All right, good afternoon from Nigeria. Can you hear me?
Yes, we can hear you.
All right, my name is Lucky Emmanuel. I'm an EBS, event-based surveillance analyst working with Nigerian Center for Disease Control. So I'm very interested, and my brother here, Usman, I dropped a few questions on the question and answer platform. So he said they work with some questions, if I get him correctly, were picked from the Nigerian Center for Disease Control website. So I want to know if he is in touch with NCDC at the moment, and also want to say I'm also available to work with Usman outside the call, so we can get this running and drive it, see how we move it in Nigeria. And for other questions, my questions are on the chat box, on the question and answer session. I would like to know if the in countries that this is running, if they are primary languages. Like in Nigeria, we have English, and then we have local languages, and how can we drive those languages? Because we have some tools like this we use in the Nigerian Center for Disease Control. We use it for data mining, but we're looking at mining this information also from the local communities and social media in local languages, in Hausa, in Igbo, in Yoruba, and all of that. So if that can be implemented in chat box, it will be good. And secondly, when will the training of trainers, the second one, so to speak, be conducted for Nigeria? I'm interested in chat box and health body. And then I also want to say, if this is a two-way communication, is it live always? Is it always live, or is it a system where automated responses are given when questions are asked? And that will be it for me. Thank you.
Thank you. That's 3 questions. Usman, would you like to? And that, I think, will be the last question, because we've run over the hour, but it just shows the level of interest and the number of questions we have. Over to you, Usman.
Yes, sure. Thank you, Loki. As you have rightly said, we implemented the project in northeastern Nigeria, Borno State to be specific. So most of our information and contents, we developed it from the Nigerian Center for Disease Control for easier and local references as well. So we invited users from the Borno State office, where we had our call-in sessions and all. And in regards to the languages, for now, we are currently working on Hausa, English, and Kanuri. So, but as the time goes on, we are also going to launch our next project, working together with Mexico, and then we might look at possibilities. That's one of the questions I got. What's the other one?
Oh, sorry. So the other is the system running automatically, or are Are there people
Yes.
at the back end who respond to people's concerns?
Yes, so it's a two-way communication, as you rightly said. It runs automatically 24 hours, but then we also have a team of people that community engagement, people that look at the messages that are received to ensure that accurate answers are being provided and given at the same time. Yes.
But please do, I'm putting my email address in the chat box, so please do get in touch. We'd be very happy to work closely with you.
Yes.
Thank you.
All right, thank you. I'm open to work with you also, Usman.
Thank you, Lucky. It's nice to talk to you.
And the entire team, Kim and everyone. Thank you, Simon. Nice presentation.
Thank you so much. And with that, it's time to bring this session to a close, regretfully. It's been a great session with very interesting work presented in a very interesting way by both sets of presenters. I hope you'll join us again for the next EPI-WIN webinar. In the meantime, please do share your views on this webinar in the Slido link that I've put in the chat. It would be great to hear back from you. And before we leave, though, I'd like to thank each presenter for coming in today, answering the questions. I mean, there were like around 30 questions and you're busy typing, and for sharing, most importantly, sharing your work with us. I hope it will lead to even greater things. And finally, I'd like to thank two people. First is Judith Van Holten, who's been in the background here, but has been instrumental in this webinar series. So Judith, could you please show yourself? And the other person I'd like to thank for the compilation of the case studies that you see is my colleague Ramona Ludolf, who's not here today because she's actually attending a science communication conference away. But she's done a lot of hard work in putting together, analyzing all the case studies. So big thanks to her as well. And please do use the case studies. The idea behind them is so that they can be adapted in all over the world, and so that they're useful for people in the community, in the communication community, to reach out. And with that, thank you once again, and see you soon. Bye.
Bye, everybody. Thank you.